Well, good morning. Welcome back to the Broadcast Retirement Network. I'm Jeff Snyder. This is BRN AM for Tuesday, April 11th, 2023. And our top story today, caregiving and mental health. And joining me now to discuss this and a lot more, Darcy Teal is a licensed mental health counselor for Help for Healing. Darcy, it's great to see you. Thanks so much for joining us on the program this morning.
Thanks for the opportunity.
Oh, yeah, absolutely. We're going to talk about caregiving and mental health. And before we get into the mental health aspect of it, I want to talk about just in general, how are caregivers doing? Do we have enough caregivers? How are they feeling right now, given the pandemic and everything that they've had to manage over the last couple of years?
Well, I think caregiving has always been a super hard job. And certainly the pandemic, like everything else, just made everything that much harder. I think I've been really happy to see this topic get some exposure because unless you've been a caregiver, you really don't have any understanding of what a caregiver's life is like.
And it really, I'm sorry to interrupt, but I just want to follow up. I mean, it's really underappreciated. I mean, as you said, unless you're going through it, and you've had to care for a mom or dad or a significant family member, you really don't know what it's like and the commitment you have to make.
Yeah. And even, when I work with caregivers, we talk about, some people don't have any support. Some people have a lot of support, people who love them and people who care about them and try to understand. But really, no one understands like another caregiver does, because you go to bed every night and wake up every morning with the weight of the world on your shoulders.
Go ahead. I'm sorry, I interrupted you.
Yeah, no. And so, and that doesn't mean we don't want to do that. I always say it's the hardest job you'll ever do, but it's also the most meaningful and significant one. When you want to do everything you can for your loved one, and you do, but it's exhausting, it's overwhelming, and self-care goes out the window usually, and it's really, really needed to avoid burnout.
Yeah, let's talk about, I want to separate the financial stresses, because there is a financial stress, which by the way can lead to emotional and mental stress, but I want to ask you about the mental toll. We talk so much about, in this country now, we're talking a lot about mental health for children, mental health for adults, the result of the pandemic, what that meant for mental health. What about the mental health aspect for caregivers? All the things you're talking about, not being able to get rest, waking up the next day, not knowing what shoe is going to drop, to use the old cliche. That's really a burden from the mental health perspective.
Well, yeah, it's... So caregivers are more likely to get sick themselves. They're more accident prone. And most caregivers would say they'd rather make decisions for themselves than for someone else. And I don't mean this with any disrespect whatsoever for those who are being taken care of, but some would say caregiving is almost harder than being the patient. And so the mental exhaustion, the lack of sleep, all of those things. And then you never know, each family has its own dynamics. Some people, their family is a team, and I'm convinced it takes a village. Some, I hear lots of stories about adult children or siblings who don't help, who won't help. So on top of not having the support, there's a lot of other emotional dynamics going on that are very difficult to deal with. But one of the hardest things mentally and emotionally to deal with is grief. And they deal oftentimes a lot with what we call living grief, especially when you're dealing with something like dementia or Alzheimer's, where you're watching your person slowly disappear. And so you're constantly grieving what your relationship used to be. And then of course there's anticipatory grief where you know the direction is only it only goes one direction, and you know that this person's life is going to end at some point. So yeah, it is very taxing on a person to have all of those different things, and you're really thrown into a world that you don't know anything about. Even if you are in the medical field, they all say the same thing. It's totally different when it's yourself. But I was just talking to a woman today who was like, I had to learn how to give shots. I don't know how to give shots. You're just not equipped and prepared. So on top of all of the emotional drain, you're having to learn a whole bunch of new skills. So it's pretty demanding.
Are there certain personality traits that if you could build the perfect caregiver, and look, we're all unique, we're all different, but are there things that you can, in talking to caregivers, being one yourself, are there certain things like flexibility, adaptiveness, the willing, understanding that you can't control everything? Are there certain personality traits that people who we're all going to be caregivers at some point, I think, most of us. What approach should we take?
The first one that sprang to mind was the first one you said, flexibility. There is so much that is out of your control. Disease progression, can't do anything about that. All of the things that happen, you can try to have a schedule. Routine is really important, especially for dementia patients, but you can wake up and suddenly, I know this happened with my husband. Oh, he woke up with lesions. So scratch everything, cancel everything. You go to the cancer center and spend the day there. Oh, who's going to pick up the kids? Who's going to, you have to learn to be flexible. You do have to be prepared, but you have to recognize that your time and the plans that you have can just get scratched any minute. And you kind of can get a routine and a normal, and then the person's status changes again and it starts all over. And things can radically change in a moment. If someone has a stroke or falls or whatever. So definitely flexibility is huge. We're looking for resilience. I mean, we are for everything in life, especially in the world we live in now, but definitely for caregivers, you have to be resilient and be thinking about the long haul, which is why self-care is so important, because it's a whole lot easier to prevent burnout than to try to climb out of that hole once you're in there. So
yep, two really important traits. Darcy, I need to take a very quick break, but I want to pick this up on the flip side of our commercial. When we come back, we'll talk more with Darcy and talk more about caregiving. You're going to want to stay tuned right here on BRN AM. Imagine a new television network that will make you richer, healthier, and in control of your financial future. This network is for the policewoman in Nashville, Tennessee, the baker in Dubuque, Iowa, the teacher in Lexington, Kentucky. We want to make the idea of savings and retirement culturally relevant. But what do you see as a defining issue of the midterms, especially for the smaller businesses? I mean, they are the lifeblood of the American economy. Featuring exclusive interviews, current affairs, and docuseries. 33 years old, you retired early.
The philosophy is money only matters if it helps you live a life that you love.
But you got to start thinking about retirement as soon as you get in
The Broadcast Retirement Network will drive very high engagement with premium partnerships. So this isn't retirement and savings for your parents or grandparents. This is for all Americans. And we're going to change the way you think about money. Welcome to the next frontier of retirement and savings. This is BRN, the Broadcast Retirement Network.
Invesco's latest Show Me the Income study reflects on the evolving retirement industry today as it faces the pressing need to help participants turn their defined contribution plan savings into long-term retirement income. Key findings from the research uncover that nearly 7 in 10 participants fear running out of money in retirement, and only 22% were very confident they could create a retirement income strategy on their own. What can employers do to help? To learn more about the study and request the white paper, visit Invesco.com/retirement income or contact your Invesco DC professional. Cited research is based on Invesco's work with Greenwald Research. Invesco is not affiliated with Greenwald Research. Invesco Advisors, Inc. is an investment advisor that provides investment advisory and does not sell securities. Invesco Distributors, Inc. is the U.S. distributor for Invesco's retail products and private placements. Both are indirect, wholly owned subsidiaries of Invesco Limited.
Tax audits, tax liens, wage garnishments.
Every day we hear stories like this about good folks who are simply struggling to pay their bills. Each of them are living a frightening IRS tax nightmare, and they are afraid it will destroy their lives.
I'm a divorced single mom, and my ex-husband left me and the kids with a lot of unpaid bills, including unpaid taxes. I was really starting to show my stress on my kids because the IRS had sent me a letter demanding a huge payment from me. I couldn't afford it. So then the IRS was threatening to garnish my wages. I'm already living paycheck to paycheck. That would have put me over the edge financially.
It truly seemed hopeless, but then a friend at work told her to call the tax relief line.
The people at the tax relief line, they told me about something called innocent spouse relief. They worked it out so that all of the taxes from my ex are not my problem. I don't know how that works, and I don't care. All I care about is that I don't owe the IRS a dime, and they are not going to take my paycheck.
Even if it seems hopeless, you should call the number on your screen right now. There is absolutely no cost for the call or the consultation. You are under no obligation. If you are worried that the IRS could garnish your wages, seize your assets, even take your home, call us right now. The Tax Relief Line is here to help you. Now you have a knowledgeable, professional team of tax experts that are ready to negotiate with the IRS and fight for you to save you money. The Tax Relief Line's professionals have successfully negotiated thousands of cases, reducing and sometimes even eliminating the tax debt for their clients. It's very easy to get started. Simply call the number on your screen right now. You don't have to live in fear anymore. The call and the consultation are free.
Well, Darcy, thanks so much for sticking with us. Really appreciate you hanging around for segment number 2 this morning.
Yeah, thanks.
We talked about at the end of the first segment about some of the personality traits, but you hinted at sometimes the family can be tearing itself apart, and maybe some of that's a reaction to the grief. I don't know. I'm not a psychologist. But what can a family do to make it easier for the caregiver? Because this person's coming in, maybe they're not a member of the family, or maybe they are a member of the family, maybe they're an extended member of the family. So what should the family do to make it easier on the caregiver or caregivers?
So I'm a caregiver coach, and one of the things that I talk to my caregivers about is even just the way they ask for help. So I just say, what I coach them to do is to just say to their family, hey, I need help on Tuesdays. Not, hey, would you mind, or could you, or would you, to be ready with a list of things at all times, because people will say, hey, let me know if I can help, because they don't know how to help. So I guess one of the first things to do is to ask, what can I do to help you? And there may be there's lots of things besides actual frontline care. Clean their house, do their grocery shopping, walk their dog, take the kids someplace. There's so many different things, provide meals, so many things like that. Let the person take a shower or get out of the house for an hour or 2 hours or whatever. What's really great is come stay for a weekend and let that person, really get out and get some breath so that they can come back and keep doing what they're doing. For people that are out of state, buy a massage for your sibling. Take on more of the finances. Fair is not always equal. So when your sibling is taking on the lion's share of the care, then you take on other things. Like with my program, sometimes family members or siblings will pitch in for the coaching because they can't be there and do that. So what they can do is support in that way. I do want to mention one resource that really was a complete lifesaver for me when I was caring for my husband, and that's called carecalendar.org. So what that is, it's literally a calendar online, and you can have somebody else be an administrator, like one of my friends administrated because I was taking care of my husband, and you put any need at all in there. And people who say, hey, how can I help? You direct them to that. Meals, all the things I mentioned, anything can go on that list. You can sign up to help. You get an email automatically that reminds you that you're doing something. The person in the home gets an email to say, hey, Susie's bringing you lasagna tonight, or John's coming to walk the dog. It's incredibly helpful. But you have to be willing to receive. You have to be willing to take help and ask for it.
And to that point, I mean, you brought up self-care, and a lot of people think, they're going to be the martyrdom syndrome, right? Where, oh yeah, I'm just going to do it. I'm going to roll up my sleeves, and just like the football player who's got a bad knee and runs out on the field and says, I'm going to do it for my team, but at the end of the day, really re-injures their knee. Well, the same thing, right, with a caregiver. You really have to look out for number one, because if number one, meaning the caregiver, doesn't have the ability to care, oops, now the caree, the patient, the person is up the creek.
Absolutely.
Without a paddle.
We always go back to that on the airlines when they tell you if you're taking care of children or taking care of someone, put your oxygen mask on first. And that's counterintuitive because you want to protect your person, but you're both going down if you don't put your mask on first. So we go back to that analogy a lot. And sometimes there's other dynamics that happen too, because sometimes the person that's being taken care of is very resistant to other people coming. They want their person, their spouse, or whoever with them all the time. And so then there's this tremendous amount of guilt if you take care of yourself at all. So that adds to the emotional stress and all of that and the anxiety that the person's going under. So, when I'm, again, doing coaching, we talk about ways to talk to your loved one about, recognizing how hard it is for them to be losing control over their lives, and that because you want to be there as long as possible for them, you really need a break and whatever. And most people, they get that, when you really acknowledge what they're going through and address their fear, then they become a little more flexible and pliable. So yeah, it's complicated. And sometimes people act totally different with a different member of the family that they do with the primary caregiver. So it's tons of dynamics.
Yeah. Last question, Darcy, and this is such an important topic that we'll have to bring you back to talk more about this. But the last question that comes to mind, America, like many other societies, is an aging society. We have more older people, and we're projected to be older. I guess we're not producing enough children and babies. to offset the aging portion of our society. But what can we do? Is it conversations like this to elevate caregiving, to help caregivers, to find more caregivers, to train caregivers? What can we do as a society to improve this aspect, which, as we've been talking about, we're all going to need at some point in our life cycle?
That's a really hard question for me because I think we have such a systemic problem that is ginormous. I think our medical, legal, mental health, our systems are just broken here. And we are, our medical personnel are taught in school that death is failure, and which is crazy because it's the one absolute universal, regardless of demographics, education, gender, whatever, we're all mortal.
Yep.
And so our system is set up so that we go to a doctor or a medical facility, they tell us what to do and we do it. And so patients aren't driving their care. The medical system is driving their care. They're not. I just went through this with one of my caregivers that I work with. I call it medical bullying. She was not given a whole bunch of information. She was not given alternatives. So a huge piece, and this goes back to what characteristics you need to be an advocate. Advocacy is huge. So if there is a way to somehow revamp all of that to not make death this horrible topic like it is here in the States. Other cultures aren't like that necessarily. To be patient driven. We've gone to specialization, which is great so that people can be experts in certain areas, but in our system, no one talks to each other.
Yeah. Yep.
Nobody talks to each other. So the burden is on the caregiver to be the umbrella, to function like a primary doctor used to be, a family doctor. They have to keep track of all of these different things because, oh, my mom needs pain medicine. So you call and they're like, oh no, we don't do pain. We do this. You have to go to this. Like, it's such a systemic problem in making our whole society patient and caregiver oriented. So I do a lot of coaching about making sure you're in the appointments with your loved one, that you're there, that you're understanding everything. And if you don't have a medical team that's working with you, you keep going till you find one. And you can tell the ones that are working with you that they want you to be educated. They're not threatened by you having a notebook and taking notes because it's about the patient. We need to treat people, and what we do is treat disease. It's a huge problem.
Yeah, that advocacy component, it's so important in healthcare and so many other areas. Darcy, we're going to have to leave it there. Really enjoyed the conversation. Really appreciate you joining us, and we look forward to having you back on the program again very soon.
I would love to.
And that wraps up this episode of BRNAM. Have a topic of interest, someone you think we should talk to? Drop us a line. And don't forget, for all the latest security news and lifestyle, wellness, finance, tech, so much more, and all in one place, check out today's edition of our daily newsletter, The Morning Pulse. Want to search our archives, check out our latest content? We'll visit our website and, of course, all of our streaming partners. We're back again tomorrow for another great edition of BRNAM. Until then, I'm Jeff Snyder. Stay safe, keep on saving, and don't forget, roll with the changes.
But if you're tired of the same
Now is your opportunity to co-create content around any topic on the First Lifestyle and Wellness Network. Reach a global audience through our platform and co-own exclusive branded content. All of our programs are available on demand and also as audio-only podcasts, so you can take us on the go. Broadcast Retirement Network, available anytime, anywhere, and on any device.